Vascular Structures of the Neck, RAD 310, Sectional Anatomy, Bachelor of Science in Medical Imaging Program, Chris Gibbons, instructor. This media module deals with the vascular structures of the neck. In this image is an example of sectional imaging aiding in the detection of disease of vascular structures of the neck. This is a CT axial image with contrast. The straight arrow points to a hypodense lateral mass in the right common carotid artery. On the opposite side, the curved arrow points to the enlarged jugular vein. The mass is actually a thrombosis in the right jugular vein. After this media module, you should be able to 1. Describe the major arteries of the neck. 2. Detail the major veins of the neck. And 3. Identify the major arteries and veins of the neck on sectional images. The neck houses some of the most critical vascular structures of the body. The location of these vessels makes them vulnerable to injury. In this presentation, we're going to be looking at some of the larger vessels of the neck. One of the methods to assess the vessels of the neck is specialized CT and MR imaging using 3D techniques, such as what's demonstrated here. This CT angiography volume rendered image demonstrates the bifurcation of the common carotid artery. The arterial blood supply for the neck and brain begin at the aortic arch. The right common carotid artery ascends the neck from its origin at the brachiocephalic trunk. The right common carotid artery divides into its terminal branches, the internal and external carotid arteries, at the level of the thyroid cartilage. The left common carotid artery begins at the aortic arch. Like its counterpart on the opposite side of the neck, the left common carotid artery ascends the neck just lateral to the trachea and medial to the internal jugular veins. The left common carotid artery also bifurcates into external and internal carotid arteries. The vertebral arteries arise from the subclavian artery. Now, you've studied these arteries already in the brain module, and they supply the posterior brain. The diagram illustrates the relationship between the vertebral arteries and the common carotid arteries. Notice that the vertebral arteries are more posterior and slightly closer to the midline, since they are located within the transverse foramina of the cervical vertebra. This illustration demonstrates the major veins of the neck, which are the vertebral internal jugulars and the external jugular veins. The internal veins are the largest vessels in the neck. The externals are more superficial and drain smaller veins from the posterior head and neck. The internal jugulars are the larger, more anterior from this lateral perspective. These veins drain the brain as well as the superficial face and neck. Vertebral veins share the transverse foramina with the arteries. This axial CT image demonstrates the relationships between the vessels of the neck. The most anterior vessel labeled here is the anterior jugular vein, which begins at the hyoid bone and empties into the external jugular vein at about the level of the clavicle. The dotted line immediately posterior to the anterior jugular vein is the carotid sheath. The carotid sheath is made of a cervical fascia and forms a protective enclosure around the common and internal carotid arteries, the internal jugular vein, and adjacent lymph nodes, in addition to the vagus nerve. Within the carotid sheath, note the large and more lateral internal jugular vein. The common carotid artery is more medial and more circular in shape. Now shift your focus to the lateral edge of the neck. This is the external jugular vein. Compare its size with that of the anterior and internal jugular veins. This is an axial CT image with contrast of the neck at the level of the oropharynx. The oropharynx is the dark, air-filled oval structure approximately at the center of the image. The contrast agent fills the vascular structures and makes them appear bright white. Let's take a look at the vascular structures labeled. First, we have the right vertebral artery. On the left side of the image, we have the right internal jugular vein, more superficial than an artery. We have the right internal carotid artery. Just anterior to the jugular, we have the right external carotid artery. And look at the top of the image. We have the right anterior facial vein. Now take a moment and see if you can identify these same vascular structures on the patient's left side. This is an MR angiography image of the arteries of the neck demonstrated in their entirety. On the left side of the image, the common carotid is demonstrated. On the patient's left, the left common carotid artery is a branch of the aortic arch. Both arteries branch into the internal and external carotid arteries. The external supplies the neck and facial structures, while the internal supplies portions of the brain. The other arteries seen running vertically in the neck region are the vertebral arteries. These pass through the transverse foramina of the cervical vertebrae and supply the posterior aspect of the brain.